For all you athletes out there, if you have ever been on the soccer field, on the track, whatever, and sprained your ankle, most likely you did some rehab afterwards to get back to 100% and get back in the game. For some of you, you were just moving furniture around your house, moved something the wrong way, and ended up with a terrible back pain. Probably your doctor sent you to physical therapy and got you going 100% again so that you could get back to work and being with your family. The craziest thing is that moms literally give birth to a baby out of their body in one form or another, which is the hugest trauma that their body's ever going to go through. And they don't get any rehab at all. No physical therapy, nothing. At their 6-week appointment, their doctor's like, yep, return to all activity, you're a go. That's crazy. My name's Nicole. I'm a physical therapist and a mom of myself, and I am here today to convince you that you absolutely need to see a physical therapist, even if it's just for one visit postpartum, to make sure that everything is working the way that it's supposed to so that you can be the mom for your kids that you imagined when you got pregnant. So the first question I think that we need to answer is, what's a physical therapist? Even more specifically, what's a women's health physical therapist? So to start at the basics, a physical therapist goes through 4 years of an undergrad program and then applies, and it's kind of a rigorous program to get into a physical therapy program, which is a doctorate at this point here in the United States. There, the classes focus on anatomy, physiology, kinesiology, hands-on patient care, everything from neuromuscular, which is recovery after stroke and brain injury, to pediatrics and little ones, to what most people commonly know is athletes and orthopedic injuries. We get a tiny bit of education about women's health, and I'm hoping that's going to be a growing thing in programs because it's definitely something that we're seeing more and more in our clinics. That's the basic of women's health physical therapy. But if you are seeking out a women's health physical therapist, which I'm hoping to convince you to do in this video, I encourage you to ask them, do they have any additional training beyond just PT school? So there's a lot of different ways that they can get continuing education and get training, but one thing that they should be able to do if they are a pelvic health physical therapist is be able to do internal vaginal exams. If you're thinking, yeah, I don't even want my therapist to know how to do that, that's okay. It's not something that is required. If a therapist ever tells you they have to do that, that's absolutely not true. But do know there's a lot of information that a therapist can glean from doing an internal vaginal exam. Beyond just training in pelvic health, a lot of women's health physical therapists go on and do some kind of specialty training for prenatal, pregnancy, postpartum care. And if this is the case, then they know a ton about you, mamas, and they are there to help you whether you just had your baby 6 weeks ago or you had a baby 60 years ago. There's a lot that women's health physical therapists can offer you. So the next question is, okay, what kind of things would I seek out a women's health physical therapist for? Well, some of the most common things that moms experience are incontinence. So you go to the trampoline park, you're jumping with your kids, and you pee your pants. Totally embarrassing, not that uncommon, unfortunately, but definitely shouldn't be the normal. So women's health physical therapy can help with that. If you are wearing pads now that you're pregnant because every time you sneeze you leak a little bit, know that this is not something that has to be that way. It's not normal, even though it is kind of common, and women's health physical therapists can address that. If you are worried about scarring from a C-section, or maybe you had an episiotomy and things are uncomfortable there, you don't feel like you're moving the same, women's health physical therapists, they can help with these things. They're super excited to give you more information about scar mobility. Lots of different ways body mechanics come into play as a mom, so positions for breastfeeding and how you're going to get your baby in and out of the crib and how to carry that freaking heavy baby carrier. These are things that women's health physical therapists know a ton about, and they just cannot wait to pour their information and knowledge onto you so that you can be the best dang mom you can be. So if you're if I've convinced you and you're thinking, okay, what's next? In the description, I have included a couple of links to some directories that is by no means all-inclusive, but a couple of places to get started looking for local women's health physical therapists in your area. Another piece that might be helpful for you to know is that there's outpatient physical therapists where you go to them for like 30 to 60 minute appointments. A new and upcoming thing is in-home therapy where they actually come to you in your own environment, so maybe you can avoid an extra babysitter. Also, people are doing online consults now, so maybe there are things that they could just help you with through video or a phone conversation to get you and your body working the way it was supposed to work, and it did before you had a baby to some extent, if that's really possible, but that's a whole nother video. So, if you like the content of this video, if you learned something today, if you have more questions, put your questions in the comment below. If you liked it, give me a thumbs up. And if you want to learn more, please subscribe to my channel because I hope to be putting out lots more content because my passion is helping mamas and know that there are lots of things that physical therapists can offer you after you have a baby. And I hope that you'll check us out. So thanks again for tuning in.